This lecture addresses some topics in the respiratory system, namely some detail about the heart position between the lungs. For example, you know that for most of us the heart points to the left, so what does that mean for the lungs? You know that the esophagus can be thought of as the food pipe, and matching that, the trachea has been called the air pipe. Whereas the esophagus goes to the stomach, the trachea, yes, goes to the lungs, but when it gets to the middle, it splits into what? Bronchi, right? And there's a ridge of cartilage in the trachea between the division of these two main bronchi. This ridge of cartilage is called the carina. For our purposes, it's fine to think of it as the fork in the road. You may also already know that while the right lung has 3 lobes, the left lung has only 2. We can think of it as the left lung is missing a middle lobe to make room for the apex of the heart. The left upper lobe also has a tongue-shaped portion, which for that reason was named the lingula. Again, only the right lung has a middle lobe. We'll come back to this. The trachea is in front of the esophagus, so comparing those two, we can say air is in front. The trachea goes down, there's a ridge of cartilage called the carina, and then we split into the 2 main bronchi. So you know the very powerful left ventricle pumps into the aorta, which starts by ascending and then arches to the left and turns descending, and this whole time we are still in the thorax. After descending for a bit, it will go through the diaphragm and thus enter the abdomen. So perhaps obvious, but thoracic aorta is ascending, then descending, and then no longer thoracic, but now abdominal after passing the diaphragm. Now, at the aortic arch, it could have been built as 4 arteries coming off, but instead the first 2 are sort of combined. So it's actually 3 total. The brachiocephalic on the right, and then the left common carotid, which is headed the cephalic way, and the left subclavian, which by going under the left clavicle will arm with blood the left arm. The carina and the aorta are right by each other. The ascending aorta is pretty much right in front of the carina, that is anterior to the carina. Then after the arch, the descending aorta is no longer in front. It's to the side and a little behind the carina. That is, it's posterolateral to the carina. As long as you are looking at a diagram or actively visualizing this at this moment, the next thing I say will be okay and not confusing. The other way to talk about this is to say where the carina is relative to the aorta. The carina is posterior to the ascending aorta, and then the carina is anteromedial to the descending aorta. Now, switching our focus, the pulmonary arteries come from the right ventricle and enter the lungs at the Hila, seeking gas exchange to oxygenate the blood. At the right hilum, the right pulmonary artery is anterior to the right bronchus. On the other hand, at the left hilum, the left pulmonary artery is superior to the left bronchus. We can, of course, look at this from the other perspective as well. The right bronchus is behind the right pulmonary artery, and the left bronchus is under the left pulmonary artery. Last item to examine is these 5 lung lobes. Now, if some fluid were to get into the lungs, assuming the patient's torso is still upright, that fluid may be pulled by gravity to the bottom of whatever lobe it's in. So what I want to draw your attention to is where the bottom of each lobe, when we view it either PA, posterior-anterior, or AP, anterior-posterior, and then also when we take a lateral view, how it shows up. The left side is easier, I suppose, because there are only 2 lobes. Looking antero-posteriorly, looking from the front towards the back, the bottom of the left upper lobe is actually really low. So the border between the lobes isn't nicely horizontal, which would have made the left upper lobe simply the superior half of the left lung. Instead, when we look laterally, we see that the left upper lobe is both more superior and also more anterior, and that the left lower lobe, while yes inferior, is also posterior relative to the left upper lobe. So lateral view would be good if we needed to distinguish which lobe has a consolidation, for example. For the left lung, I'll say the point is this. If on AP view you see a consolidation that looks pretty low but isn't quite at the bottom of the left lung, I don't want you to mistake it for left lower lobe when it might actually be left upper lobe. Then on lateral view, if you see it towards the back, for sure it's left lower lobe. The right lower lobe is a lot like the left lower lobe. It is the one that occupies most of the bottom and also occupies most of the posterior lung space. Just as the border between the left lung lobes is not perfectly horizontal, the line is not perfectly horizontal, but instead sort of slopes forward. It's the same for the right lower lobe versus the other two. The only other item I'll point out is that the right middle lobe reaches down medially. Make sure to take the time to look at a picture at some point, for example, hopefully right now, so that you can see exactly what I'm talking about. So if a consolidation is all the way at the bottom, it's right lower lobe. If it's close to the bottom but also fairly medial, it may actually be the right middle lobe. Let's also mention here that the most common pathogen for lobar pneumonia is Streptococcus pneumoniae. The intraalveolar exudate is what brings about the consolidation. By the way, let's make sure we also know that this term, lung consolidation, it simply means that the air that is normally there has been replaced by something else. That's all it means. Again, in this case, it's an exudate, not transudate, exudate, so it's protein rich. And in addition to the common strep pneumoniae, you'll want to know that it also could be something like Legionella or Klebsiella, causing a pneumonia affecting an entire lobe or multiple lobes, that is causing a lobar pneumonia. Okay, let's tie it all up. The trachea travels down into the thorax in front of the esophagus, but ultimately behind the heart. The landmark where the trachea splits into the two mainstream bronchi is the carina. The ascending aorta is anterior to the carina. In contrast, the descending aorta is posterolateral to the carina. Which lateral? The descending aorta is more on the left. In the right hilum of the lung, the right pulmonary artery is anterior to the right bronchus. In contrast, at the left hilum, the left pulmonary artery is superior to the left bronchus. The left lung has only two lobes, an upper one and a lower one. The tongue-shaped portion of the left upper lobe is called the lingula. The right lung has three lobes, an upper, a middle, and a lower one. The lower lobes of both lungs occupy more of the lower and posterior portions of the lung. Okay, that's it for this one.